The goal of ablation, of course, is to deliver treatment by destroying tissue, by creating a lesion. And of course, this lesion needs to be permanent. And if we're talking about complex arrhythmias and we're going to make complex lesion sets, one of the main challenges is you're going to make all these tiny little lesions and they need to be contiguous. There cannot be any defects, any gaps in the lesion sets, else the treatment is going to fail. So one of the holy grails of ablation, let's say, is to deliver true contiguous ablation, just like the surgeons are doing if they cut a heart open and they sew it back together. Well, this is of course a perfect model for a contiguous lesion set. And what we set out to do with this technology and what we set out to prove in these trials is that we may have a technology that is indeed able to provide true contiguous lesion formation in the human heart in a percutaneous setting. What we found in our efficacy data is that the system is highly efficient in an acute setting. We have not yet reported or published long-term outcomes, but what we can share today is that acutely the system is extremely capable of doing exactly what we hypothesized it would be doing, which is to make continuous linear lesions, achieving electrical block, which is the ultimate goal of creating these lesion sets. And we saw both for the flutter model as well as for the PV isolation model that the system achieves 95% plus acute isolation rates without effort in a first-in-man setting, with the first experience without trained operators, without technological improvements. Our safety findings, fortunately, were excellent, because obviously one of the main concerns of any technology, and in particular a new technology, and in particular a potentially very powerful technology, is that it might have safety side effects. And fortunately, we took a lot of precautions in our trial precisely to avoid safety issues, and we observed indeed that there were very few or no safety issues, at least on the permanent side. We did see a few transient safety issues in the very early experience, which we managed to mitigate successfully by making some design changes, and even those safety issues fortunately resolved over time. So I'm very happy to say that on the safety side we can show really excellent results.